The beginning of destruction of the old healthcare system. Is this a sign of the collapse of the old system that we all have been waiting for? Question mark. We all hope so, right? As of October 1st of 2025, the US government has announced about the government shutdown due to the Congress has forgot to submit for the federal appropriation, and therefore there's no federal funds. How this could be impacting you, whether you're a solo provider or whether you have a clinic in the outpatient mental health field within the United States. Let's talk about that. And it's good to think about this now to prevent maybe some situation that we don't want to be in. Let's talk about some strategies. Let's do some assessment. What is it that might be impacted? Number one, of course, we want to think about the billing and the reimbursement. Do you have any delays, or are you currently experiencing any delays in reimbursement? Even if you don't, it might be a good time right now to look at in your system and see what is it that you need to install or create any system in the processes to prevent any further delays. Or maybe you simply don't have any system at all, and this is a good time right now to look at your billing and cash flow. Do you track your billing on a weekly, on a monthly basis? Do you know how much is supposed to be coming? And if you have some delay, that might be a sign for you to look into your own processes. Number two, there might be possible expiration of telehealth flexibilities. There are Medicare, TriVest, or TRICARE insurances, or many commercial insurances do have a contract with federal funds that might be impacting your cash flow. So if you do, or maybe some people have just 100% federal funds contract, Medicare or Medi-Cal, even state-based Medi-Cal, this is the time for you to think about diversification of the income. Number three, there might be some risks of delayed grants of new program approvals. If you're heavily connected to the state or federal funds, this is the time for you to also look into your situation and maybe think about diversification of the sources of income. Number four, there might be some changes in the patient's behavior just because they might be listening to some news, and I know currently right now there could be some delayed or even cancellation of the flights and the airport, and this could be impacting the whole system, the whole living system as well for people. That might trigger some traumas, that might trigger some fears in people, and some of your clients or patients might be triggered to stop attending some sessions, or maybe some sessions might not be consistent. That might affect your income and cash flow. It might be a good time for you to communicate strongly with your clients and your patients and let them know that you are with them, that nothing have impacted you and your relationship with them, and you will continue to stay present in their care. Number five, administrative bottlenecks. Even though you might not have any impacts right now in your system, it might be a good time to really think about what are the systems that you might be creating at this point. And the reason for this is that a lot of federal workers right now being furloughed, they are on the standby. And as you can see, in the airports, the flight being delayed or canceled, what are the other processes within your state or county or on the federal level that might be impacted or delayed? This could have a snowball effect. So again, think about that and think about what you need to do right now to prevent any further situations that might be complicating. Number six, there might be an increased competition from other providers adapting faster. We all talked about the bigger companies that are VC heavily backed, technological companies that they do have access to fundings. They might be expanding faster and might be adopting faster than you are. Since we're talking about this, I wanted to really look at in this situation and think how you can adjust to this and create, I guess, any strategies and the system that would help you to stay not only afloat but to be thriving. So let's talk about some strategies. I have developed some lists for you that I'm implementing myself within my clinic. So there's some short-term strategies, mid-term strategies, and the long-term strategies. Some of them might be applicable to you, some might be not, but I thought it might be helpful to talk about the strategies that I have been using within my clinic, and maybe that information might be helpful for you, whether you're a solo provider or you have a clinic in the mental health, healthcare in the United States. Short-term action plan. Number one, as we talked about, assess revenue mix and exposure by payer type. If you have one type of insurance that you might be accepting, maybe Medicare or maybe two, this is the time to think about diversification and add some more payer mix, maybe some commercial insurances, managed care insurances, any other ways of doing so you can stabilize the situation for yourself. Number two, accelerate collection and cash services. Account receivables, co-pays, any account receivables that you have, that you're leaving the money on the table. So this is the time for you to look at your billing processes if you are an insurance provider, so you can collect more. Number three, focus on stable reimbursement services. Something that reoccurring every week. Do you track your services? Do patients come back if this psychotherapy on a weekly basis? Is this is psychiatry? Maybe do patients come back on a monthly, on 2 month or 3 month basis or 4 times per year? Maybe this is the time for you to think about the lifetime value of your patients, meaning how many times they come back to you throughout a year, how long do they stay with you? Assess this, evaluate this, and make some changes. Change your strategy. Number four, optimize telehealth usage within compliance. Again, diversification. If you are a provider that have been seeing your clients or the patients just locally in your office, maybe this is the time for you to think about to add telehealth options. If you're a telehealth provider, think about adding other geographical locations so you expand more geography to it. There are different ways to look at the strategy, but just expand your services. Look at the map. Number five, advance funding requests before delays. There might be some options for you to look at and see what are the options exist for you to get some advance in funding. If you are a cash provider, you might be collecting some payments upfront. How do you collect your copays? This is the time for you to look at your copay processes. Number six, communicate with your payers proactively. See if there's any possible changes within the cash flow and reimbursement might be coming up due to the US government shutdown. It's good for you to know about this now. Number seven, reduce discretionary spending, your expenses. This is the time for you to look at your expenses and P&Ls. And see what are the expenses that doesn't have any conscious focus. Bring it all down, even if you don't have a P&L, maybe have an Excel spreadsheet and put all your expenses down and see what are the necessary expenses and what are the expenses that are variables and you don't have to have them at this point. Bring conscious focus to all your cash flow and expenses. This is a good time. Number eight, retain patients through reassurance and consistent marketing. Talk to your clients, talk to your patients. It doesn't matter whether you're a solo provider or you have a clinic, send them an email, talk to them through your clinicians. Reassure them that you are not impacted, that you will continue to provide services to them, that you will not abandon them, that you will be with them throughout all the time. that might help. If you're currently experiencing any delays in account receivables collections, maybe delay in reimbursement, cash flow, or you're simply looking for a new billing provider, I can offer to you my Cyber Management Group. We provide credentialing and billing services for about 10 years to other clinics and solo providers within the United States. To connect, click the link below the video and my team will meet with you and answer all your questions. Let's talk about the midterm strategies. Number one, expand non-federal revenue sources through private insurances and self-pay options. So adding a mix of other payers might give you an option for a stability. So you have the strategy to work with insurances in different rates. This is a good term also for you to increase the average per session. If you are a self-pay clinician or a clinic, this is also might be a good time for you to look at adding some insurance, some different insurances to have also diversification of income and source of income. If you're an insurance provider, maybe this is the time for you to think about adding the self-pay options. This is what we have been doing right now. We're working on adding the self-pay services. Number two, build hybrid care models with sustainable telehealth. We talked about this before in the short-term strategy, but if you have some telehealth or you don't have some telehealth, then this is the time to add the telehealth options, and that might give you flexibility in terms of the expenses. So you might reduce some expenses if you're going to add some telehealth. You might add more clinicians throughout some geography within your state. So this is a good option. Number three, partnerships. Partner with other clinics and health organizations. This can create a great resource for you for your referral system. And who knows, right now, the marketing source or Google Ads, as you see, the Google SEO and Google pages have been impacted through recent regulations with AI. And a lot of Google Map pages have been taken down. That might be impacting your referral source. Who are your partners that are next to you? And who are the partners that might be complementing your services, or you might be complementing them with your services? Reach out to them and create some sustainable referral system. Number four, target underserved or rural markets. This is the time for you to also expand, whether you're gonna set up a local office or telehealth option. So there are a lot of patients might be left out without services because some clinics might be closing the doors. And you might acquire those patients. So be proactive and search the way to expand yourself. Number five, highlight clinic quality and outcomes. What are your qualities? And what are your outcomes that you can work on? Just market yourself better, position yourself better. This is the time for you to look at your website, look at your SEOs. What is it that you need to change? Number six, monitor policy updates to stay compliant and adaptable. It's good to see what's happening in the market, but also not to be afraid of changing your strategies. So be flexible, be adaptable. Even though the news might be changing every single day, but I guess position yourself as you have an opportunity instead of a fear that you might be closing your doors. Always good to look for opportunities. And many companies and the clinics before, during the previous US shutdown and crisis within the United States, have actually succeeded and expanded. Why? Because they flexibly changed their strategy and positioning, and other clinics have closed their doors. What kind of provider are you? Are you the one that's going to expand? Are you the one that's going to close the door? That's for you to decide. Number seven, it's very important. build your financial resources, assets, and perform scenario testing. And it doesn't matter again that if you're a solo provider or you have a clinic to run, it's good for you to assess for any accessibility to funding. Like, do you have a line of credit? Do you have a line of business credit, business loan, any means or assets that you can have access to? Work on it right now. And of course, the last one that I always recommend, the book of Mike Michalowicz, Profit First. This is the time for you to set up Profit First system. Your profit come first. Even if you're going to start with a couple of percent and increase it to 10%, on a weekly basis, start building that asset for yourself. It's a business, so anything can happen. So right now, I would highly suggest for you to work within all your system, all your assets, and see what strategy you need to utilize. If you have any strategies that might be helpful for others to learn about, I would suggest and encourage you to comment below the video, or simply I'm inviting you to join our Global Alliance of Mental Health Providers community. There are providers from all states within the United States. You can share your strategies, but you can also learn about the strategies of other people. Long-term strategies. Number one, capture displaced telehealth patients. Some clinic might be closing some doors, and there might be some patients wander around. That's a great time to acquire those patients or those clinics. Number two, launch preventative care or wellness subscription plans, membership, concierge models. You know, the whole healthcare industry right now are going into concierge or membership plan on models. We're not different. We're also within the healthcare industry. So this might be a good time to think about adding the wellness and other services that might be ancillary, like nutrition or aesthetics, other programs that might give you a recurrent cash flow. So concierge, membership, and wellness programs. That might even include some coaching programs. So expand your services and line of services. Then when one service might complement the other or might be adding benefits to your patients. Number three, partner with employers for EAP or employee health programs. Maybe you can create a very creative EAP program that might be helpful to many companies. What are your specialties? Do you have your specialty? If you don't have any specialty, you have a generalized care, whether you're a solo provider or a clinic, this is the time maybe to add some specialty. Number four, add ancillary services such as nutrition or aesthetic. You can add it to the wellness category. You can also think about coaching. Just expand your funnel of your services, that one service can complement the other one and could be a good referral source to the other one. Business people and business companies, they use different funnels to get some and acquire some patients, the pool of patients, and then they add another service on top of it that have a higher profit margin, and then maybe even the third line of service that also giving them a profit margin. Do you have a system that might be giving you a good funnel of your referrals within your pool? Number five, expand regionally with satellite clinics. In what areas or geographical locations you can add satellite offices or telehealth options. Just expand your geography. Number six, use data analytics to negotiate better payer contracts, rates and reimbursements. We need to do that every year. And number seven, seek non-federal funding or grants. Are there any options for you to have access to different programs, non-federal, or funding that might stabilize your financial situations? So basically, in summary, there's a key triggers to watch: the congressional resolution or continuing appropriations. There's a CMS and MAC operations update. Just watch for any updates. Watch for payer behavioral changes or telehealth policies. Watch for patients' visits trends. And of course, always, that is on a consistent basis. Watch for agent receivables and reimbursement patterns.